Hello everyone, this is Dr. Wu from Department of Cardiology, the first affiliated hospital of China Medical University. Today we are learning definition and classification of hypertension. First, let's learn conception. Hypertension is a cardiovascular syndrome with the main clinical manifestation of elevated systemic arterial blood pressure, target organ damage, including brain, heart, eye, kidney, and vessel, and metabolic change. Hypertension includes two types. The first one is essential hypertension with unknown cause. About 95% of hypertension is essential, also called hypertensive disease. Another one is secondary hypertension. It is hypertension with known cause. About 1 to 5% of hypertension is secondary. Epidemiology. Lowering blood pressure significantly reduces the risk of cardiovascular events. Hypertension is the leading cause of death of cardiovascular disease in China. Among Chinese adults, about 1/3 of the residents have hypertension, and the diagnosis rate, treatment rate, and control rate of hypertension are low. The management situation of hypertension is severe. Etiology of hypertension. Hereditary and gene hypothesis. 60% hypertensive patients have family history. If both parents have hypertension, incidence of children with hypertension is 46%. And environmental factors, diet, highly salty diet, and drunk, and stress, and smoke, and also other factors, including overweight, drugs, and OSAS. Pathology of hypertension. Central nervous system control of blood pressure. When the blood pressure declines, the sympathetic nervous system secretes norepinephrine, which constricts arteries. Norepinephrine acts on small arteries and arterioles to make them smaller, which in turn increases resistance to the flow of blood or raises the blood pressure. Kidney control of blood pressure. The kidney regulates blood pressure by controlling the extracellular fluid volume and secreting renin, which activates the renin-angiotensin system, and also other mechanisms, including vessels reconstruction, endothelial cells function, and insulin resistance. Clinical manifestations. In early phase, the patient may feel nothing. It can be asymptomatic or with great BP variation, or the patient may feel headache, dizziness, palpitation, fatigue. Physical examination may be abnormal A2 and S4, aortic area systolic murmur. In late phase, there may be manifestation of complications. Clinical manifestation of target organs. Heart, related to accelerated AS, may be angina, myocardial infarction, sudden death. Related to BP level, may be heart failure. Brain, related to accelerated AS, may be TIA, stroke, brain thrombosis. Related to BP level, may be cerebral hemorrhage, encephalopathy. Kidney, renal angiopathy, renal arteriosclerosis, and renal failure. Artery, blocking lesion, claudication, aortic aneurysms, and aortic dissection. This picture shows target organ damage, including brain, heart, arteries, and kidneys. How to do evaluation of hypertension, including the following aspects. First, is it real? Is it because of nervous? Is it essential or secondary? Is there any end organ damage? Are there any other cardiac risks and comorbid conditions? Investigations of hypertension, including history, physical examination, and the lab examination includes urinalysis, CR-BUN, uric acid, blood glucose, and so on, and other examination, including ECG, echo, X-ray, fundus of eye, ambulatory blood pressure monitoring, and special examination, including renin, ANG, aldosterone, corticosteroid, angiopathy of artery and kidney artery, echo or CT for kidney or adrenal gland. This table shows diagnosis standards of hypertension. Office BP, systolic BP over 140, and or diastolic BP over 90, home BP, systolic BP over 135, and or diastolic BP over 85, ambulatory BP, including 3 aspects: daytime, nighttime, and 24 hours. Daytime systolic BP over 135 and or diastolic BP over 85. Nighttime systolic BP over 120 and or diastolic BP over 70. 24-hour BP, systolic BP over 130 and or diastolic BP over 80. This table shows standards of optimal normal BP, stage 1 to 3 hypertension, and isolated systolic hypertension. Optimal BP, SBP should be less than 120. DBP should be less than 80. Normal BP, SBP should be less than 130. DBP should be less than 85. Stage 1, SBP 140 to 159. DBP should be between 90 to 99. Stage 2 hypertension, SBP 180 to 179. DBP 100 to 109. Stage 3 hypertension, SBP more than 180, DBP more than 110. Isolated systolic hypertension, just SBP over 140, DBP less than 90. Risk assessments and prognosis includes 3 aspects. The first one is risk factors. Includes age, male more than 55, female more than 65, smoking, dyslipidemia, diabetes, early cardiovascular family history, abdominal obesity or obesity, high blood homocysteine. Target organ damage includes left ventricular hypertrophy, carotid atherosclerosis plaques, and so on. Concomitant disease includes cerebrovascular disease, cerebral hemorrhage, stroke or TIA, heart attack, myocardial infarction, angina, PCI or chronic heart failure, kidney disease, and peripheral vascular disease, and others. This picture shows stratification of total cardiovascular risk in categories of low, moderate, high, and very high risk. It is calculated according to blood pressure and total number of risk factors, target organ damage, or disease. So much for today. Thank you.